Today we're going to be doing the upper extremity. I'm going to be working all the muscles related to the upper extremity, the brachium and the antebrachium. This is the brachium, this is the antebrachium, and all the muscles that relate to it, along with some of the nerves. I'll remind you again to please make sure you take a good medical history and write down if they take any medications or any accidents or anything that has been going on maybe with the arm. I do recommend that you do the Hawkins test, because the Hawkins test will let you know if there's any shoulder impingement. The Rose test is for the TOS, the Thoracic Outlet Syndrome. The Finkelstein test is for the Corvian tenosynovitis, and the crossover test, and that's for the supraspinatus impingement. So I'll put a link below so that you can make sure and do a good assessment. That's the most important thing to do in clinical massage, is to do a good assessment. I'm also going to be doing some trigger points. So remember that that the trigger points, you're only going to hold them 8 to 12 seconds, 20 max. And first, I start with myofascial release. I kind of start doing some warming up of the muscles, and I'm going to go ahead. I don't use any oil at the beginning, so I might be doing just a little bit of squeezing, a little bit of pinching, grasping like a seat clamp at the upper trapezius. In the previous video, we talked and treated the scalenes right here, and all the nerve plexus that goes through the scalenes and underneath the clavicle here, and sometimes it can be entrapped by the pec minor. The pec minor originates in ribs 3, 4, and 5, and it inserts right at the coracoid process. So we need to treat that for anybody that might have thoracic outlet syndrome. And there's 5 nerves that go through the brachial plexus here, through the scalenes below the clavicle, and goes out to feed the whole arm, which is the musculocutaneous nerve, the radial nerve, the ulnar nerve, the radial nerve, and then the median nerve and the axillary nerve. The deltoid is innervated by the axillary nerve. So I'm going to treat all those muscles, and if they feel any shock or electricity running down when you're working on them, please get off of it, okay? Because you don't want to flare up that muscle more. So let's start with a little bit of myofascial release. You can spread the muscle here. I like to put a towel underneath. Thank you. So it really, pops up the biceps brachii and the brachialis. So I can do this here. And if I turn it, the hand, palm down for pronation, then I can get some of the triceps, some of the deltoid. So I'm just trying to do some myofascial stretching, so I can hold at the elbow and pull forward. I'm pulling with this hand and pulling backwards with the left hand, just to create some myofascial release here. And then when I'm ready to apply some oil or lotion, whatever you guys use, just a little bit. You don't need a lot. So just for it to glide a little bit. So I'm going to go ahead and start with the upper trapezius here. I like to pinch between my fingers because I can't really use my thumbs anymore. So there's usually a common trigger point here at the upper trap. And so what I do is I just kind of press it. What you're looking for is, it feels like tight bands. It feels like a hard string, like a guitar string in between the muscle fibers. Remember, muscle fibers are long like your hair. Those are the myofibrils that make up muscles. So you feel, or a nodule. Sometimes you can feel like a little nodule, like a little pea size. So you want to go ahead, if you feel it, and if the trigger point is in an acute stage, you can hold it anywhere from 8 to 12 seconds or up to 20. If it's in the chronic stage, you could hold it, a little bit longer until the client finds relief. So now I am going to be working now the pec minor, the origin of the pec minor here. And if, if the client feels comfortable or uncomfortable, you can ask her to cup her breast and just cover her hand over the breast so that you don't uncover it, and you can more freely treat the origins. of the pec minor 1, and the ribs 3, 4, and 5. And while you're here, you might as well work the attachments of the sternum from the pec major. And right underneath the clavicle, because remember that the brachial plexus goes right below the clavicle here. Now you go to the coracoid process of the scapula, right here, gently. You can do some circle motions, and don't press hard. Remember, you're doing light palpation because you don't want to hurt the client, you know, you don't want to make them jump. And, oh, and something I need to tell you about trigger points is a trigger point is usually in the belly of the muscle. You know, that's the medius part. Think of the muscle as a river, and then the belly is like in the middle, right in the middle of the river, where there's more action and it's deeper and it can do more. You know, they have to do more work. So that's usually trigger points are in the middle of the belly, but not always. Okay, not always. So then now you want to treat. I'm moving down. Now I'm moving here to the deltoid. Remember, the deltoid originates on the third lateral part of the clavicle, the spine of the scapula here. So it comes down to the deltoid tuberosity. This is where it inserts. So usually the trigger points are here on the anterior deltoid, middle deltoid, or posterior deltoid. So you can grasp between your fingers and just feel, see if there's any issues going there. I'm still trying to warm up the muscle a little bit. So now I am working the deltoid, and make sure you go to the origins here at the lateral third of the clavicle and then the spine of the scapula. So this is all the deltoid, and it inserts at the deltoid tuberosity. So check to see, and I like to check with my fingertips, my finger pads, and you know, just go over it. And as we move down, we go to the biceps. And one of the things I like to do is I can put their wrist at my waist level, and just with both of my fingers just go up the biceps brachii, and also the brachialis is underneath. I'm kind of just really pressing my fingers against each other, popping that muscle up. That way I can stay away from the nerves and the arteries and the veins that are closer to the soft tissue. So this is one way to treat the biceps, and also to hold their hand and then have them supinate and pronate. You can supinate and pronate for them while you extend and you glide, because remember that the biceps is also for supination, along with the supinator. They both supinate. So I like to pronate, supinate like you're holding the soup while I glide. And if you find any trigger points, you know, you can hold it, you know, just, I haven't found really, she's so muscular, I haven't found anything on her. Oh, I want to work on the pec major. So go ahead and grab, put your hand over your breast. Yeah, I'm going to bring this down just a little bit, and I am going to grasp her pec major. Her pec major right here. It forms the axillary fold, and underneath that you can even feel, you know, like you press like this just with light finger pads, you can release. Is that her right there? Yeah, I found something there. Finally, I found something that feels tight. So I would just press, I'm pulling down with my left hand and pushing up with my right where the trigger point is. This is actually a common trigger point for the pec. There's another one too, like on the 5th rib, right at the same line as the nipple, right below the armpit. That's a common, also a common trigger point. So anytime you find trigger points, I like to do a little bit of circular motion. until the pain starts fading.